That is coming, and it's coming fast because of the new technologies and communication and medical research and AI. We expect that stem cell therapy and infusions will be mainstream medicine here in the next 2, 3, 4 years. And there are even some insurance companies talking about starting to pick up part of the tab, which is new. But we've also recently, as recent as last week, gained access to a medical finance company that will help people gain access to stem cell therapies through our program and finance it for up to 60 months so it can become very affordable.
That's great. Yeah, I think like Howard mentioned earlier, there obviously you actually had the stem cell is it called infusion? Is that the right word for it?
Yeah, I did an IV
I,
infusion. They
okay.
do joint injections and spinal space injections, disc injections, muscles. I've seen people use it as an intramuscular injection for certain kind of disease states. What I'm most fond of, and what I have seen people get the greatest rewards from, is the IV infusion. In other words, take 50 million mesenchymal stem cells, which are the umbilical cord cells that are trapped in the umbilical cord between mother and fetus. The baby's born, they clamp the umbilical cord. Those stem cells have never reached the baby, so they're not yet DNA directed. And so they're in neutral. And they can become any cell in your body. And as soon as you introduce them to your bloodstream, the ones that are needed immediately are directed by your DNA by signaling, by frequency, some of the terms you may be familiar with from watching TV and reading the news. But that's all done autonomically. All you got to do is stick the stem cells in a vein, and your body takes it from there. You become the DNA director of those stem cells. They are directed to replace damaged cells from injury or illness, and then it starts the whole cycle up. The beauty of getting a quantity of stem cells in a bulk like that is that many of them will go into your body's storage capacity, which is your bone marrow. And they'll begin to duplicate and grow at a normal human rate, which is hundreds of millions of times a month. Some people even talk about it duplicating in an optimal body that's healthy, a healthy, internal organ, up to close to 1 billion times a month, which means that a simple IV infusion could be the one thing that changes the game from being miserable to being in a decent state of mind, physically, mentally, emotionally.